When it comes to water management programs, efficiency and compliance are everything. LAMPS by HC Info is the award-winning all-in-one cloud platform trusted by facilities teams, water treatment professionals, and health departments nationwide. With LAMPS, you get a comprehensive water management plan system with tools to be successful like IoT sensor data analytics and direct lab automation. And it's all in a single easy-to-use application. Save time and money meeting ASHRAE 188, ST 108, CMS, Joint Commission, and state requirements. Plus, LAMPS offers the industry's fastest path to ASSE 12080 Legionella certification. Ready to take the next step in your water management compliance and certification? Visit scalinguph2o.com/LAMPS to request a demo from a LAMPS expert today. Once again, that's scalinguph2o.com/LAMPS. LAMPS by HC Info, making your water management program defensible, sustainable, and smart. Hey there, Scaling Up Nation. It's Trace Blackmore here with a shout out to all the hardworking water treaters out there. You deserve a partner who's just as dedicated as you are. That's why I want to introduce you to my friends Sarah, Drew, Dave, and the rest of the crew at North Metal and Chemical Company. North Metal isn't just about delivering high-quality chemicals. They're about delivering exceptional support from experienced professionals who understand our industry inside and out. Their unmatched service means they're ready to ship your Northwest brand chemicals when you need them, no matter the challenge. With their commitment to small businesses and long-term partnerships, North Metal and Chemical Company is here to help you succeed every step of the way. Visit scalinguph2o.com/North today and learn how they can support your water treatment goals. Once again, that's scalinguph2o.com/North. North Metal and Chemical Company, serving the water treatment industry since 1921. Welcome to the Scaling Up H2O podcast, the podcast where we scale up on knowledge so we don't scale up our systems. I'm your host, Trace Blackmore, and we are smack dab in the middle of Legionella Awareness Month. And this is the month where we take a hard look at Legionella, Legionnaire's disease, and other waterborne pathogens. And the whole hope this month is that you're getting some information so you can have better conversations with your clients so they can ultimately make better decisions. But the whole purpose of this month is to give you more information so you can become more educated around this and other topics. Now, one of the things that we have talked about, and many people out there in the Scaling Up Nation are already certified, and several are wondering, should they get the certification? Well, what am I talking about? I'm talking about ASSE 12080 certification. There are a lot of different companies that can help you acquire that certification, but I want to talk a little bit about why I think it's important you as an industrial water treater do seek to get certified. ASSE 12080 is a certification that more and more water treaters are getting to show their clients that they know what needs to go into building water management plans. But here's what it's also doing. It's exposing you to different information and different ways to look at that information so you can ask better questions, so you can create better plans. As I mentioned, there's so many great resources and companies out there that are helping us prepare to pass the ASSE 12080 examination. But I want to talk about all the tools becoming certified brings to you. It exposes you to all different things around water management plans, but it also exposes you to different people that are getting certified. Now, depending on how you take the class, if you're taking a self-study class, you may not meet that many people, but if you're taking a course where you are meeting other people, that is a great resource to ask them what they've seen and what questions people have had for them. So now you can start thinking about that and how you would answer questions around that. Now, ASHRAE has a standard 188. We've talked about that this month, and understanding ASHRAE 188 is so important. I said this on an earlier episode, and I'm going to say it again. I am surprised at how many people I talk to that are in our industry that have never read that standard. Folks, it's out there. It is available. It's not very long. I would suggest that you read the standard so you know the basis of where a lot of other agencies are getting their information. So really easy to do. I'm willing to bet if you do a search, you can most likely find it. And if you can't, you can buy it from the ASHRAE website. I don't remember how much that is. Most likely, you should be able to find a copy of that somewhere. And now you know what that says. So why would you get certified? I believe that more and more people are going to require that if you are going to be an integral party in their water management plan, that you have this certification. I've seen it in a couple of companies, not all companies, but I will say I really think, if I can make a prediction, that this is coming. So right now, you're going to set yourself apart. Later, you're not going to be able to play in the game if you don't have this certification. There are also other agencies that are requiring ASSE 12080 certification, like CMS compliance, the Centers for Medicare and Medicaid. They have stated that they require certified professionals on water management teams. Well, maybe that could be you. Joint Commission, if you're working with hospitals, they also want certified people on the team and overseeing water safety programs. There are so many other people that are getting involved and now learning about this certification. So chances are, if you haven't been asked to get certified and you're doing water management plans, you are on borrowed time. So it's my hope you hear this prediction and you decide that I am going to get certified. If this is the type of work that you do, I would encourage you to take the next step and get certified before a customer says you are not qualified to help them in whatever capacity that you are wanting to help them within this water management plan. I really think that that's coming, and I think now you can be proactive rather than reactive. Nation, that is one of my favorite phrases, is how can I be proactive and not reactive? Another phrase that I will ask myself is, how do I know what I don't know I don't know? And by doing that, I am now challenging myself to learn new things, to do different things, and to meet new people. So it's my hope that each and every week you get a little taste of that from our friend, James McDonald.
Hello and welcome to What Do You Know? The game show where we find out what do you know about industrial water treatment, drop by drop. So pump up your brain, take out that test kit of knowledge, and prepare to answer this week's question on What Do You Know? Today's question is, despite all the training, engineering controls, policies, regulations, laws, and direction, at the end of the day, who is most responsible for your personal safety? You. Yes, there are and should be many layers to keep you safe in your job, but it is up to you to follow them and use common sense to keep you safe. Your family, friends, and colleagues are counting on you. I'm James McDonald, and thanks for playing along with us. Stay tuned for next week's episode of What Do You Know?
Well, thank you, James. And if you want to catch up on any What Do You Knows, you can simply go to scalinguph2o.com, look at previous shows, and we're going to have those very easy to find for you. Something else that is easy to find for you on each and every show is we are doing a discussion guide on each and every show this year. We're going to do it from now on, but we started doing it in the beginning of 2025. And we have heard that so many people are taking an episode, having their company colleagues listen to it, and then they're having a conversation about that. Well, we want to make that as easy as possible for everybody to do this and everybody to challenge what it is that they think that they know, what it is that they don't know, they don't know, they don't know, and how can we be proactive in all of that? Well, a way that we can be proactive to help you is through these discussion guides. And it's meant to facilitate conversation after people have listened to podcast episodes. And we've been getting some great feedback on the discussion guides. And they are free for you. All you have to do to get one is to go to scalinguph2o.com and look for the discussion guide. Most likely there'll be a pop-up for the current episode, and you can simply download that from there. We are trying to make things as easy as possible to learn not only in the podcast, but also outside of the podcast. And the idea of the discussion guide came from one of you, the Scaling Up Nation. And we want to make sure that we are providing you content you want and ways that you need to make sure you're getting the most out of that content. If you've got an idea like that, please go to our show ideas page. Let us know what you would like, and we will try to accommodate. This is the podcast for water treaters by water treaters, and we're trying to make sure that we are elevating the bar in every single step in the water treatment industry. Well, Nation, as you know, we've been inviting each and every week this week new members to the Scaling Up Nation to let us know their expertise in the world of Legionella and waterborne pathogens. Here is that next interview. My lab partner today is Dr. David Krause of HC3. Dr. David Krause, welcome to the Scaling Up H2O podcast.
Well, thank you, Trace. Great to be here today.
Super excited to talk to you and all the things that you are doing. But before we get there, do you mind explaining to the Scaling Up Nation who they are listening to today?
I'd be glad to introduce myself. Again, my name is David Krause, originally from Florida and practiced out of Tallahassee. I'm a certified industrial hygienist and a toxicologist, and have really come into the world of water treatment via public health outbreaks and investigations.
I'm curious how people get into the field that they are in. What happened to get you where you are right now?
Well, my career path after spending a few years in the U.S. Army over in Europe during the roll down of the Cold War began as an industrial hygienist for the Bureau of Environmental Toxicology for the Florida Department of Health, where I was tasked with setting up a statewide indoor air program. So indoor air quality was really my pathway into public health and investigating. And Legionnaire's disease and a few other waterborne pathogen outbreaks were kind of thrown to me, as there weren't a whole lot of other field people to go out and do those investigations. Later on in my career, working with the American Industrial Hygiene Association, and we saw that industrial hygienists were being called more and more into this field to assist when there weren't enough people in public health. And as the state toxicologist serving for the Florida Department of Health later in my career between 2008 to 2011, was actually asked to help write the state guidelines on how we conduct investigations.
David, how have you seen in your career awareness of Legionella change?
Well, I've certainly seen an increase in the number of reported cases, the number of confirmed cases, the number of outbreaks. And when I've had these conversations with policymakers, politicians, governors, the awareness is shocking. I've actually had one senator tell me, well, didn't we cure Legionnaire's disease in 1976? No, sir, we discovered it in 1976. And it's been getting worse ever since.
Well, that's perplexing to me because I guess I'm in the industry and that's one of the main things that we talk about. But there have been enough outbreaks that the common knowledge is out there that Legionella is something that we need to be aware of if we have a water system that could possibly contain Legionella bacteria and infect a population. So what do you think the catalyst is for more people to be aware of it?
Well, I think it comes down to that we actually have more cases. We have more cases and outbreaks. The public health definition that's been established by CSTE, which is the Council for State and Territorial Epidemiologists, has been pretty steady up until 2019. And then there was a a slight change then that actually expanded the number of cases that may be counted. But diagnoses really haven't changed. I'll say the medical community systemically underdiagnoses Legionnaire's disease. You have to have a very specific test to determine if you as a person are sick from it. A lot of people are treated empirically with just, here, take these antibiotics, and if you feel better, great, don't come back. Bottom line is, I believe it is changes that we've had in our infrastructure, degradation of our infrastructure, plumbing systems, those in our buildings, and ultimately a lack of broad research, fundamental broad research. And much of the information that is in guidance from the CDC and state health departments is not based in evidence. It's based on best practices that we think will work, but not necessarily based on studies, empirical evidence, and rigorous study.
When ASHRAE's 188 came out months later, then we had the outbreak in New York. Of course, everybody was talking about that. Again, very perplexing that more people don't know about it outside of this industry. But that being said, cases are on the rise, and CDC reports that every year more and more are being reported. Now that the people that are at least in the know do know more about it, we have ANSI's 12,080, where people are now getting certified to write better water management plans. With all of that in place, why are cases on the rise?
Well, there was actually an interesting article published by authors from the CDC, I think in 2007, looking back at the increase that occurred from 2002 to 2003. So in 1 year, there was a 70% increase year over year of the number of cases. It shook everybody in the public health field. And when it came down to it, they looked at diagnostics. Was there more resources? Was there more attention? Were there more clinical tests done? And all of that was insignificant, not compelling to say that this is why we had such an increase. And most of that increase occurred in the central Atlantic states, Maryland, Pennsylvania, Virginia. And if you just looked at those states, I think it was over a 315% increase. The authors kind of, I think, punted and said it was because of increased rain levels. And I've actually gone back and looked at that and looked at the data that they relied upon. Ironically, 2002, the year they were comparing the rain levels to, was a historically low period of rainfall. And 2003 was a slightly elevated increase, period of rainfall. But ultimately, looking at the trend, the ongoing trend from that point to today, it's continued to rise, yet rainfall has not continued to rise proportionally. That may be an association, but not anywhere near a causation. Ultimately, something else that happened in 2002 that isn't talked about or associated with this is implementation of the Safe Drinking Water Act Disinfection Byproducts Rule Stage 1, which established regulatory limits on disinfection byproducts. And in my practice since then, what we've seen in the municipal water system is a lowering of the levels of disinfectant residuals making it to buildings.
I mentioned New York earlier. There are a few municipalities that have followed suit. What is your thoughts on how municipalities are going to adopt things and now make it a law that people have to do something with their buildings, with their water systems when it comes to Legionella?
I don't have great expectations that municipalities are en masse going to establish additional regulations. I couldn't point to regulations that would tell you that the numbers are going to decrease from any particular action that has been required. Even in New York City, their case counts still continue to go up and down depending on the year or unknown factors. And another thing that's troubled me is since ASHRAE 188 was initially published in 2015, except for the pandemic years where we think other factors were at play, that hasn't made a substantial dent in things. So I think public health is essentially flailing at the efforts to stymie additional cases and outbreaks. And a lot of it just comes from the lack of rigorous research on what does it take to really prevent Legionella, and are we measuring the right things?
What would you say some of the right things would be?
Well, up until 2015, the CDC and public health agencies would tell you, do not proactively sample for Legionella in your water. And that just shocked me. If I want to know if there's a risk, the only way to know if it's there is to sample. I think you've heard that from some other people. After 2015, even in ASHRAE 188, there's no mandate or requirement to monitor for the pathogen that you're trying to control. And then the CMS memo was fairly straightforward on it in the beginning, and then that was recalled and changed to say, well, we're not telling you actually have to sample. Imagine trying to control or reduce cancer rates in the United States, but telling people you don't actually have to test to determine if you have cancer. Just eat your vegetables and get some exercise. Sampling is a part of early warning. And without that, I think we're bound to continue to see increasing rates.
Have you ever seen a water management plan that says don't sample?
Yes.
Interesting.
At healthcare facilities. If you don't have to, people won't do it because they're scared. There's not a prescriptive step to take if you find Legionella. The other side of that is, why are we worried about Legionella inhibition or non-pneumophilus species? Yet public health and many health facilities just see any Legionella as being a risk factor. And I don't think the data bears that out.
We started this entire conversation with people aren't aware of this as they need to be. So you just added, not only do we need to educate people that Legionella is a thing, but there's so many subspecies out there, and we need to just look at one.
I think we need to understand the relevance of Legionella pneumophila and specifically serogroup 1. That's the one that actually causes disease that we can diagnose. 94% of all cases in the United States are diagnosed just with the urine antigen test. And that only picks up antigens caused by Legionella pneumophila serotype 1. So we believe there's 89, I think a new one has just been added, maybe 90 species and serotypes. And, I've done long-term monitoring on facilities, and we see other types of Legionella come and go and become established. Nobody's sick. Nobody's complaining. Nobody's diagnosed with Legionnaires or Pontiac fever. And, the question is, are we looking at a biosystem in which where the other species may actually crowd out Pneumophila? Or is Pneumophila a little bit more finicky in its Goldilocks zone and where it likes to live?
So when it comes to somebody getting sick and multiple people getting sick, we call that an outbreak. You've been involved in several investigations after an outbreak has happened. Do you mind sharing with the Scaling Up Nation what happens after, okay, we now have this outbreak, you've been called in, what happens when the health department goes in and they're investigating?
Yes, I've been involved in outbreak investigations both as a public health official working for the State Department of Health, as well as a private sector consultant. And it really depends on where the outbreak occurs and the education and experience levels of the public health officials you're dealing with. It is not the same all over the country, and many have not been thoroughly trained, resourced, yet they are tasked with doing these investigations. I've been put in that position or helped county health officials try to investigate these. Clear your calendar is what I would tell somebody. If you get that call, and it usually comes about 4:30 on a Friday afternoon, that we suspect that you have an outbreak going on at your facility, and you'll start hearing that. One of the first questions to ask is, do we have any fatalities? Because about 1 in 10 in a community-acquired case actually pass from Legionnaire's disease. If it's a healthcare-acquired case or outbreak, it's about 1 in 4. So if you start hearing case counts exceeding 10, you're probably going to start hearing about fatalities. And that certainly happened in some of the larger outbreaks we've dealt with in Atlanta, in Asheville, during the Mountain State Fair, Flint, Michigan, as well as New York.
All right, David. So it's Friday at 4:30 in the afternoon. We get that call. What's the process?
Well, Legionnaire's disease is a nationally notifiable disease. And in every state across the United States and in many countries around the world, an individual who's diagnosed with Legionnaire's disease or Pontiac fever has to be reported to the local county health department, state health department, and eventually to the CDC. When they start seeing a nexus or a common exposure, they go knocking on the doors. What will typically happen is the health department will send you a letter or give you a phone call. Hopefully, it's also not with the local news media showing up on your front doorstep, but that sometimes is the first time people hear about. But they begin an investigation. They interview the individuals or their next of kin as to what exposures they may have had in the previous 10 to 14 days before their onset of symptoms. The building owners and building operators are then interviewed, and often the first notice they have is the health department showing up with a team of investigators and water bottles and chlorine measurement devices, and they start sampling everything they can get to: the cooling towers, the water heaters, the showers, the hot tubs. Sometimes they sample swimming pools, which is a bit of a misnomer because swimming pools are not associated. Cold swimming pools are not associated with outbreaks. And then they'll sometimes say, you need to restrict water use, stop people from using the water at all. If it's a healthcare facility, that's more likely. If it's a hotel or a residential apartment building or an office building, they'll often tell people to post signs and turn off the water until they can fix it. Now realize they won't get sample results for usually about 2 weeks. And once those results come in, then you're expected to take actions. Often when I'm consulting with a client, I tell them it's not going to hurt anything to begin treatment immediately. And sometimes use of point of use filters can be accepted and adopted as an interim measure, a Band-Aid, a water restriction action that can allow you to continue occupying the building and using the water until sample results are in and any mitigation or remediation measures are implemented.
You mentioned the media. When we had the outbreak here in Atlanta, people found me in the local media and wanted to know what the heck Legionella was. And it was amazing how much drama they tried to pack into that news story. I would say some did better than others by just educating, but they felt they had this story that would shock people. I heard somebody in the news agency say once, if it bleeds, it leads. People were warning people, hey, don't come to downtown Atlanta. You could die. That was actually on our news. And they came here to the office and we were able to explain a little bit better what Legionella is. But that's an issue. We're trying to get good information out there. And we have bad information because it's leading information. What is something the industrial water treater can do to maybe call that so we can get better information out there?
Panic during an outbreak is expected, and communication during an outbreak, effective communication, truthful communication, proactive communication can solve a lot of problems and prevent a lot of problems. The more communication that I've been able to put out there during an outbreak, the less likely we find it that actually litigation or lawsuits ensue. But most people want to go into bunker mode and not say anything. So you need to have an informed communicator who understands what they're saying. And really, first thing is don't put out information that you're not certain of. And that can be almost as bad. I was involved in the case that you're mentioning here in Atlanta, and my team got the biggest kick out of it. There was an image created in the one of the local newspapers, and it showed these people in full hazmat suits and this dust storm behind them walking through an investigation. We all kind of laughed about that, and as we're running around with nitrile gloves and N95s, not quite the drama that the media put out there.
Well, we had one newscaster that was reporting live in front of the cooling tower where it was suspected the outbreak happened, and she had a power generator behind her. So you should probably ask before you make statements like that.
Absolutely. Absolutely.
How does the water treater get involved during an outbreak like this?
Well, often they're the first ones that are asked by either the building owners or the health department to collect samples. And that really puts them into a potential conflict of interest. If they have a history or, it's their responsibility or they're contracted to maintain that water system of that cooling tower, especially, and then are asked to essentially grade their own homework, collect samples that could either exonerate them or shoot themselves in the foot. That's a very tough position to be put in. You want to help people, but you also want to stay in your lane and not put yourself into a potential conflict of interest. I've seen where water treaters have gotten pulled into collecting samples from the hot tubs and then the building water system, which they weren't treating. And then they're asked to interpret the results when they come back. And if that's not your cup of tea, you might want to just say, we'll work with whoever you bring in. But if you're not a consultant and used to dealing with outbreaks and the firestorm that is coming, make sure your systems are working. Make sure your records and logs are available. Make sure that the information you have on any past samples that you have taken as part of routine monitoring are ready and available for public health officials to review. But I've seen some really great guys pulled into a morass of testing and advice that they weren't prepared to jump into.
One of the common questions a lot of water treaters will ask their customers is, do you have a water management plan? Most people will say no. Then the advice is, well, you need a water management plan. And then the customer will have some sort of version of no, whether it's not law, I'm not being forced to do that, or we're doing something else. What advice would you give to the industrial water treater when they're trying to guide their customer in that direction?
Ounce of prevention is worth 10 pounds of cure. The disruption in business, the inevitable litigation, the damage to reputation, millions of dollars in testing and remediation and modification to your systems is quite common. I won't say assured, but it's quite common when an outbreak of substantive size occurs. And these are people's lives. These are pathogens that you're not ready to deal with. And when they affect people, like I said, one of the first questions I ask is, do we have a fatality? Because that changes the filter in which you look at this. So that's tough. People in general, and throughout my career, whether I'm dealing with air quality or water quality, workplace or residential or community, they don't want to spend money and resources and time on things that hasn't happened yet. Why do we need to worry about it? And one of the things I try to explain to people is the environmental conditions and the focus on these diseases has changed. The water you receive has changed. Your building's water systems have changed. They degrade over time. And the implications can be devastating. I believe the place that we're talking about actually went bankrupt in Atlanta and was foreclosed upon eventually. And they pointed back to that outbreak as being the core of their demise.
The local health department is the first people that come on scene. What happens to get the CDC involved?
Usually it's a complex case, numerous fatalities, community-wise. If it makes national press, they're probably going to get involved. The other aspect is the local health department is usually the lead. The state health department is almost always brought in as a consultant. But when the complexity or the number of cases or the public notoriety of the case rises to a sufficient level, then the CDC is often, they're at least consulted, if not brought in to help immediately.
An interesting question. They all have different guidelines on what and how to test. Who wins that?
Oh, once you start an outbreak, testing is the coin of the realm. Once you have an outbreak, that's how they determine where the sources are, what the risks are, what organisms are present. If the organisms you find match genetically the organisms that are recovered from people who've become sick, and then after remedial efforts, after you try to disinfect those systems, I call it Legionella jail. You will be testing for months, if not years, and submitting those results to demonstrate control and the absence of Legionella amplification in your system. So they tell you don't test or you don't have to test, but once an outbreak occurs, testing is your life. And these are not cheap samples.
Time for a quick break, Scaling Up Nation, as we hear from one of our sponsors. When infection control is crucial, water quality can't be left to chance. Aquamedics delivers proven protection with innovative point-of-use and inline water filtration systems trusted by hospitals and healthcare facilities nationwide. Aquamedics filters use advanced fiber membrane technology with 0.2 micron pores to block Legionella, Pseudomonas, and other dangerous bacteria right at the faucet, shower head, or ice machine. Whether you're responding to a waterborne outbreak or building a proactive water management plan, Aquamedics has the solution to safeguard your most vulnerable populations without chemicals, disruption, or delay. All Aquamedics filters are ASTM F838 tested and available for rapid deployment so you can act fast when it matters most. Protect your facility, patients, and staff with Aquamedics. To find out more, go over to scalinguph2o.com/Aquamedics. Once again, that's scalinguph2o.com/Aquamedics. Aquamedics, your partner in waterborne infection prevention. A big thank you to our sponsors. They help keep us running. And now, back to the interview. After an outbreak, what has to happen? What box needs to be checked in order for that facility to get back to, I'm using air quotes, business as usual?
Yeah, that has changed over time and is, I'll say, very much not consistent throughout the United States. So whether state to state or within a particular state or community, traditionally it had been once you identify the source, carry out remediation, and then start testing. So testing that shows, once a week for 4 weeks, non-detectable levels of Legionella. Then if you make it through 4 weeks of non-detect, you can go to once a month for 3 months. If you make it through three months of that, then you go to once a quarter for the rest of the year. And then they recommend at least quarterly. And as part of that, they tell you you have to submit to us a water management plan to move forward. Now, historically, and I've seen this actually in Atlanta on other cases and other locations, that any positive samples for Legionella resets the clock. So if you've gone through the weekly testing and the monthly testing and you get into quarterly testing and you have a positive of 10 CFU per mil.
Is that serogroup 1 or any Legionella?
It depends on who you're talking to, but maybe any Legionella, it resets and now you go back to weekly, you re-remediate and you begin testing once a week until you can make it through without any detectable. I've seen facilities go for years trying to get out of that endless loop. That's becoming less common. And I've seen where in New York, they will just say, get through, 3 rounds of testing in the next month and you're done. So it really depends. And I'd say it's arbitrary and not evidence-based.
What would you say your biggest lesson learned is through your years of experience in these investigations?
Oh, gosh. I'll say my biggest lesson learned has been that we really haven't taken the time to understand what it takes to control Legionella under most conditions. We've used a lot of assumptions about the efficacy of disinfectants and the reliability of treatment modalities. And those assumptions will bite you in the rear end. They come to rear their head when you assume that if I treat with a 50 part per million of chlorine, that it will kill all Legionella.
Including the equipment.
And the equipment, yes. I've talked to many water treaters who refuse to do hyperchlorinations because it turns that plumbing system into a sprinkler system. And you can say that 100 times to a client, but when the health department's saying you need to carry out a hyperchlorination, then that's what they do, and they suffer the consequences. And unfortunately, I've seen after those actions, the organism reestablish relatively soon and begin growing again because they didn't fix the underlying cause. They didn't take the time to understand the underlying cause for that facility. And the current treatment modalities have numerous unintended consequences. And, that's what led me to investigating an alternative approach.
Well, that's where we're actually going next. Do you mind sharing with the Scaling Up Nation what that alternative approach is?
Well, sure. Again, remember, I kind of come at this from a public health vantage point of a toxicologist. My academic training is in pharmacology, toxicology, human health risk assessment, occupational exposures. And so it struck me that what we're doing with current treatment methods, so I'm going to really focus on drinking water, on the premise plumbing system, the drinking water, the heated water systems of a building. And what we're doing is we're injecting toxic substances, chlorine, monochloramine, chlorine dioxide, things that we use to disinfect and decontaminate buildings for anthrax. Now we're injecting it in our plumbing system at what we believe to be safe-ish levels, but they have an impact. When they react in those environments, they actually generate known carcinogens. Again, there's no way of chlorinating a water system without generating disinfection byproducts such as trihalomethanes and haloacetic acid, as well as chlorites and initiating corrosive processes, leaching lead and copper. So it's kind of like chemotherapy. You try to kill the cancer before you kill the patient. You're trying to kill the bug before you destroy the water system or harm people. I thought there has to be a better way. There has to be a better way. Is there a way that rather than adding one more thing to our water system, can we remove what is critical to its life function? Can we remove one thing? And unfortunately, Legionella tends to like everything we do. It likes the same temperatures. It likes the same pH. It likes plenty of water. It's actually very chlorine tolerant. You can hurt its feelings. You can interrupt it a little bit, especially when it's protected within biofilm or within amoeba and protozoa. It can withstand up to 100 part per million of free chlorine. So, quote, eradication, I think, is a silly notion. So what I did was reviewed the literature and came across a few initial studies, just a handful of studies. One as early as 1978, published by John Feely, a former CDC microbiologist and founder of a laboratory there in Atlanta, who noted that Legionella is an obligate aerobe, meaning it needs dissolved oxygen in its environment to grow and to live and to metabolize. It doesn't have a facultative anaerobic pathway. And so there was a few other studies and articles that looked at Legionella would not grow under certain dissolved oxygen concentrations. And so I started looking into what is dissolved oxygen. Can you have water without dissolved oxygen? Now we're talking about not the O in H2O. That's not what we're talking about. That's chemically bound and isn't going to be removed. But when you have water in contact with air, you have rapid oxygenation of that water. And if you aerate that water, such as with a sprinkler or a spray or a bubbler, like you have in a fish tank, you're adding oxygen to that water. And there's a low concentration, usually around between 4 and 10 part per million of dissolved oxygen in the water. And that's necessary for fish and other invertebrates, as well as bacteria to metabolize and to do what's called metabolic respiration. So I thought, what can we do to actually make an environment that removes that dissolved oxygen and maybe inhibit Legionella's growth? Not necessarily kill it, but just make an environment where it doesn't grow well. Well, prior to 2000, the year 2000, that was not really optional. Water treaters probably know this very well. You would, when you create water for a boiler, you often deoxygenate that water to prevent it from corroding the interior of that boiler. Water can be very corrosive for chip manufacturing, for computer chips, or pharmaceuticals. So whole technology was established and eventually produced by 3M, which has now become Solventum, of gas transfer membrane contactors. And so prior to that, you would actually add hydrazine or toxic oxidizers that would make the water entirely undrinkable and unsafe. So until these gas transfer membrane contactors were developed and marketed and produced by 3M, there wasn't a practical way to reduce dissolved oxygen in drinking water. So went down that pathway, did some proof of concept testing, and developed a way to reduce or remove the vast majority of dissolved oxygen in drinking water. And Legionella simply won't grow when the dissolved oxygen is below a certain level.
Well, that's fascinating. I have to ask, how do you get dissolved oxygen out of a drinking water system?
Well, with these gas transfer membrane contactors, imagine that it's a bundle of 1 million straws, tiny little straws, about 5 micron in diameter. in each of these straws, there's a laser drilled hole. And these laser drill holes on the side are big enough to let gas molecules pass through, but small enough to prevent water molecules from passing through. And so they've bundled these together, and you have air or nitrogen passing on the outside of the straws, and you have water passing through the inside, and you have a vacuum in that air. So the vacuum and the air rapidly pulls the gases out, and you can go from 8 part per million to 10 parts per billion of dissolved oxygen in a single pass. So this is often used in manufacturing and industrial processes to remove dissolved oxygen. Otherwise, it doesn't affect the chemistry of the water, the safety of the water, the drinkability of the water. As a matter of fact, people often think that deep well water is some of the best that we have. We pull it out of the ground and it's good to drink. There's no, microbial contamination. And as long as you don't have certain gases in there, it's great. Most of that water is anoxic, because by the time that water has made it down through all those layers, the oxygen has been stripped from it from microbial processes, chemical processes, or just time has caused it to become anoxic. So the oxygenation process has brought it back to a cleaner, well water-like condition.
How much oxygen is required for a favorable environment to grow Legionella?
Well, that was really the point of one of the research projects I did. So we actually worked with a laboratory in Pittsburgh to set up systems to find that threshold. How low do you go? How low do you have to go? There had been some publications back in the late 70s, early 80s by Fleermans, where they had sampled hundreds, I think over 700 rivers, streams, lakes, ponds to find the natural habitat for Legionella, and specifically Legionella pneumophila. One of the side measurements they took was dissolved oxygen. And a note in looking at those measurements was that they never found it growing at concentrations below 0.3 part per million. So we wondered, okay, well, is that kind of where its natural homeostasis won't support life? So we set up a hot water system. So we've actually set up a treatment method to treat circulating hot water systems, since that's the most risky area for Legionella in building water systems. And we're able to inoculate a model system, a hot water tank and the plumbing system that it would serve, inoculated it under safe laboratory conditions with Legionella pneumophila serogroup 1 and serogroup 5, actually even with NTMs, non-tuberculous mycobacteria, and make sure that the system would actually grow. And then we flipped the water switch and ran it through and incrementally dropped over several weeks the concentrations of dissolved oxygen. And Legionella, as with a few other microbes, is what they call a microaerophile. It actually does better at lower concentrations until you get to its threshold. So in that, 2 to 0.5 part per million, it seems to do fine. But as soon as we got below 0.3 part per million, we started seeing log reductions in Legionella that were growing in that system, and until we went to non-detects. So very coincidental with the earlier data from natural environmental samples. So it appears that if you can manage to keep the the average, the median concentration of dissolved oxygen below 0.3 part per million, you don't need other modalities. You don't need chlorine. You don't need heat. You don't need copper, silver. You don't need anything else. Under that condition, Legionella, though it may be present, if it's brought in by the municipal water system, it's simply not going to be able to settle, grow, colonize, and amplify.
How many of these systems are in use?
We're still in the pilot phases. So we've developed, I'll say, a refrigerator-sized device that plugs into a circulating hot water system for a building. And we initially installed it during the pandemic in a set of apartment complexes in Baltimore that had had an outbreak in the past, and offered to offer their facility as a pilot test. They had struggled with other treatment modalities, and we found that they were constantly, I'll say 1 in 3 times when we tested, the incoming water was containing Legionella. So we ran a pilot test there in 2022 and learned a lot of lessons, identified ways in which the system can operate well, and since then have revised the system to have an onboard nitrogen generator and made some other modifications. and are currently working with some other healthcare facilities right now to pilot the next beta version of the system. So it's not in production yet, but the technology is sound.
If everything goes well, is this something that would require EPA registration like a biocide would?
Well, under the EPA FIFRA, or Federal Insecticide, Fungicide, and Rodenticide Act, there's two different, I'll say, categories. One is a registration. So if you add a chemical that claims are made to kill or inhibit, it has to be registered, a registered product. This actually doesn't add a chemical. It actually removes a chemical, oxygen. So it wouldn't make that, require registration or permitting under that regulation, but it would need to be a regulated device. That would be similar to maybe a UV system. I'll say there's a bar to entry, but it's not a very high bar. It's registration of the manufacturing location and the claims and what it does and what it doesn't do. But it would fall under those requirements as a regulated device. But it would not trigger or prompt permitting under the Safe Drinking Water Act as a public water system.
What needs to happen for these units to be proven viable? And this might be the next step in everybody's water management plan.
Yeah. As a preventive measure, it's certainly a lighter touch. Instead of generating corrosive products and carcinogenic byproducts, it actually removes the potential for corrosion. It inhibits corrosion. If you don't have oxygen, you can't produce iron oxide. We think the next step really is determining the long-term operational costs. We're not adding chemicals. You're not generating those processes. These systems are built to be installed as a side loop treatment for a hot water system. We could do it as well for an entire building, but that does require a much larger contactor as you have to run more water through it. But really, it's a matter of what are the long-term costs and operational requirements to maintain the system over years. So that's the next phase, and that's where we're going there. And then it's a matter of those that want a product or an approach that doesn't trigger regulatory oversight, permitting, perpetual testing for disinfectant byproducts and the unintended consequences. We call it LIDO, LIDO, for Legionella Inhibition by Deoxygenation. The LIDO system actually makes preventive maintenance and potential extending the life of your water heating systems achievable. We've published our findings in peer-reviewed publications. So in August 2022, published an article on the role of dissolved oxygen in the growth of Legionella pneumophila. And then in March 2024, we published the results of our laboratory model challenge test that I mentioned in Pittsburgh in the Journal of Occupational and Environmental Hygiene. Both of these articles are open access. They're peer-reviewed publications, but are open access, so they're free and available to anybody who would like to read them and access them. We feel this is really important because in my history as a toxicologist and in public health, one of the trends that I've seen is that when we take pollution or control measures that are useful at large scale, in my past experience at a power plant or at a manufacturing facility, we use filtration systems and electrostatic precipitators and desulfurization processes to remove pollutants from the air. And they work great there because you've got an engineered system, you've got a lot of power, you have safety protocols in place, you have everything necessary for it to work and be maintained and controlled. When you try to scale that down to something that sits on somebody's desk in their house or at their office, they often fail miserably. So control measures that work at large scale often don't work at small scale on the consumer product. And I think we've traveled down that same path with water treatment. So the treatment that we use in large scale at a treatment plant or at a campus, great. But trying to take that same system and inject chemicals into a building and its water systems has a lot of unintended consequences that really haven't been thought through. So I think we need to really understand and explore appropriate scaling of technologies that are right for premise plumbing systems rather than just blindly taking whatever we've used in a large building and injecting it into the building's water system where we're heating the water, we're recirculating the water. We need to use the water for dialysis. Now we've got carbon filters in the water. I mean, None of this is even on the radar of your local municipal water system.
This has been a fascinating conversation. If you'll provide the links, we will put those papers on our show notes page so anybody that listens has easy access to that. And if somebody wants to learn more about what you're doing, what's the best thing that they can do to contact you?
Visit our website at www.hc3fl.com and leave us a message. There's links there about LIDO and what we're doing to examine this type of technology, other types of systems that are at great risk. LIDO isn't going to work for every type of system. Like, it's not going to work for a cooling tower. A cooling tower, you absolutely need chemical control, but it is a challenge. It is an absolute challenge. Each type of problem we run into is going to need its own type of fixes and controls. And we're there, we work with the people on a daily basis to understand how their systems are growing microbes and what they can do to minimize that risk.
Well, David, I have a few lightning round questions if you're ready for them.
I'll give it a shot.
All right. Question number one. If you could go back to your very first day as an industrial hygienist, what advice would you give yourself?
Oh, gosh. My first day as an industrial hygienist, I thought somebody was playing a joke on me. The craziness and the unbelievability of the problems that were presented to me, I simply did not believe. And I would tell myself, take good notes because you couldn't make this stuff up if you tried.
I normally ask people what are the last few books that they've read, but I want to ask you, what are some of your favorite Legionella resources?
Well, actually, I'm going to be a little self-serving here. I'm an industrial hygienist, and traditionally, water treatment, water monitoring, water pathogens have not been in our wheelhouse. Yet we are often asked to examine this as a risk factor. So in 2015, I worked with several of my colleagues to develop a consensus guideline called the Recognition, Assessment, and Control of Legionella in Building Water Systems. And then in 2022, we updated that since a lot happened between 2015 and 2022. And so that is a resource that is published by the American Industrial Hygiene Association for anybody to be able to use to help them understand the risk factors, how to investigate outbreaks, and how to investigate water sources and systems, and guidance for a framework on how to investigate and prevent waterborne pathogens and disease. The other group that I work with is the American Conference for Governmental Industrial Hygienists. Just rolls right off the tongue. ACGIH, in 1999, the Bioaerosols Committee, an esteemed group of people who I learned so much from, published Bioaerosols Assessment and Control. And it's also called the Red Book. But it is a wonderful compendium of everything you should know about bacteria, fungi, parasites, allergens in the indoor environment. Ironically, it used Legionnaire's disease and Legionella as an exemplar in many times. But realize this is 1999. This is before we started seeing this significant uptick in Legionnaire's disease. And there was practically nothing in the book in the 1999 first edition that addressed Legionella control, where it grows, how to mitigate it, remediate it, how to test for it. So when I was invited later in my career to join the Bioaerosols Committee and to work with my colleagues to update this great compendium, I was very honored. So I actually worked on several chapters, one of which was bacteria. That's a pretty basic one. And we integrated Legionella and other waterborne pathogens into that, and remediation. So within that chapter on remediation, we have, I'd say, half of the chapter is on remediation techniques, testing, validation procedures for waterborne pathogens, including Legionella, Pseudomonas, and non-tuberculous mycobacteria. So that one, I really, while I may be an author, I certainly don't receive any benefits from it, but I would encourage everybody to become comfortable and familiar with those two texts. They are a great resource for people who are dealing with this issue.
We'll be sure to link those on our show notes page as well. Well, the movie Erin Brockovich was about chrome and cooling towers, so Hollywood knows that puts butts into seats. So eventually they're going to talk about Legionella. When they do and they make a movie about your life, who do you want playing Dr. David Krause?
Oh, that's easy. George Clooney. Never say Brad Pitt, right?
Great answer. Last question. If you could talk to anybody throughout history, who would it be with and why?
Oh, Benjamin Franklin. That guy was a hoot. An inventor. I would love to sit down and have an evening of conversation with him. All that he did in this country and for this country. Fascinating fellow.
Well, you are a fascinating fellow and learned so much. I mean, very excited to see how your research pans out. And when you have an update, we'd love to have you back on the Scaling Up H2O podcast.
Well, thank you for the invitation. We'd love to join you again.
Well, thanks again, David, for coming on the Scaling Up H2O podcast. And Nation, David actually was an introduction from a Scaling Up Nation member to me. And that's how we're getting a lot of our guests. So if you know somebody you want me to interview, please let me know who that is. You can go to scalinguph2o.com, go over to our show ideas page, and you can let me know who that is. And just like David Krause, we can introduce ourselves to him and get a new guest on the Scaling Up H2O podcast. Now, I was fascinated by this conversation and his novel method of controlling Legionella by reducing dissolved oxygen levels. Hopefully, it sparked a lot of questions, a lot of what am I going to do next to research this in your mind, as it did me. So if you want some more information on what to do next, go to scalinguph2o.com, go to this show's show notes page, and we'll have some resources that Dr. Krause gave us so you can continue your research on the topic that he brought to us today. Nation, it's my hope that you this month are thinking how you can have better conversations to your customers around Legionella. And how do you challenge the things that you know and make sure that there's not new information out there and make sure there's not new technologies out there? And if there is, great. How do we now bring that new information, those new technologies into our regular conversations with our customers? So ultimately, that creates bigger conversations with our customers, and they are able to take those conversations, include other people within their world in those conversations, and then we're able to have better outcomes. Folks, we have so much information on waterborne pathogens that are out there. It is difficult for us to know everything. So by trying to learn the next thing is how I've always tried to keep up with all the things that are going on within the industrial water treatment community. I will say it is very difficult to keep up with everything in the industrial water treatment community because so much is happening so quickly. I don't think you can always stay on top of things, but you can make a habit to always learn new things. And that's a habit that will make it so you are always making sure you're not staying stagnant and you are being the best industrial water treater that you can be. Nation, that's the only thing that we can ask for. And if we're all doing that, we are making this industry better. The mission of this podcast is to raise the bar in the industrial water treatment industry. And if that's the way you're thinking, you're doing that, and we are doing that together as the Scaling Up Nation. Nation, I said this before, but if you've got a show idea or you have a guest that you want us to talk about or interview, please go to scalinguph2o.com and go over to our show ideas page. Let us know all about that. And that is how we ensure that we always have topics for years to come. It's my hope that you are planning to go to some sort of conference to figure out what the next thing is that you need to learn about. My hope is that you're doing searches on things that you're trying to learn the next thing about. It's my hope that you are always trying to learn the next thing. And of course, the next thing for us will be a brand new episode for you in Legionella Awareness Month, and that will be next Friday. Until then, have a great week, folks. There's no doubt about it. Taking the Certified Water Technologist examination is one of the most challenging tasks you'll do in your water treatment career. But I'm here to help you with the first step. And that first step is my free gift to you, and that is a free CWT prep course. That's right. If you go to scalinguph2o.com/CWT prep, you'll get a portion of the paid course where you can see the type of materials that you'll be working with if you decide to sign up for the full course. Again, this is my free gift to you to get you on the journey to getting your Certified Water Technologist designation. Go to scalinguph2o.com/CWT prep today.